All right, welcome back, everyone. Today we're going to be talking about physical activity slash exercise and bladder symptoms. And I'm really excited. Today I have my friend Courtney. She is a pelvic floor physical therapist. She is from Phoenix. And yeah, hey, Courtney, welcome to the show.
Hi, I'm so excited to be here. It's my jam to talk about pelvic floor and women's health and all of the things all the time. So it's like anytime I get a chance to yap about it, I'm like all about it.
I love that. You and I recently yapped on Instagram Live and we had a good time and we knew we had to do something more. So I'm really glad that you were able to give us some of your time today.
Yes, I'm super excited to be here.
All right, awesome. I think the easiest place for us to start is to kind of introduce yourself to the audience and I want to know, how did you get into pelvic floor PT?
Okay, so everyone always has their like traditional, like, I want to be a physical therapist because story, right? But I always knew I wanted to be a physical therapist, like literally since I was in high school, probably is when I figured it out. So my journey was always PT, but I never knew that I wanted to be a pelvic floor. I didn't even know what the pelvic floor was until I got into physical therapy school. So it was never like that was never the goal. So the goal was to always work with athletes, sports, orthopedics, like all of that. And then like as I went through school, I realized that, or I like started doing CrossFit a lot, and I was like well versed in that population to where they always had pelvic floor issues, and it was always like a topic. And while I was in school, like you don't get much education on it, right? You get like a hour lecture, like that's it, and it's like, oh, here's what the pelvic floor is, here's what it does, and like that's it. So then, like, all of these women at my gym would like complain about like leaking or like pain or like random women's health issues. And I was like, what is this? Like, what's going on? Like, why is this so normalized? Like, when we talk about knee pain, like, it's like, oh, the arthritis or like my back pain and like bulging discs. And it's kind of like everybody kind of talks about it. But it's more pelvic floor, women's health. Like, people are like, hush, hush, but also like, oh, it's okay. Like, it's normal. But people aren't like, oh, it's normal to have knee pain. Oh, it's normal to have back pain, you know? And so that's kind of when I was like, okay, I really just want to work with female athletes. But then I knew that like I was missing the boat on like treating the whole female. Like if I didn't become a pelvic floor PT, there's no way I would be able to treat female athletes like wholeheartedly. I'd be stuck to like knees and ACLs and meniscuses and like hip impingement and like low back pain and like shoulder pain. And like while those things are fine, like it just didn't bring a lot of fulfillment to like changing quality of life for me. And so I was like, well, let's get certified in women's health. And then took the certification courses, all of that fun stuff. And then from there, I was like, okay, this is like my jam. Like, this is like actually what lights me up and like brings passion to my career instead of just being like, oh, I helped another athlete play soccer again. Like, and there's nothing wrong with that. Like, that is a very like need. It's a big need, right, for PT still, but it just wasn't for me. And so I went down like the pregnancy, the postpartum, the women's health like route, and taking all the things I knew about sports performance and strength and conditioning principles and typical rehab things, and I applied it to literally just women in the pregnancy postpartum period and helped them get rid of other symptoms that nobody really knows are actual things that can be healed and fixed. And that's kind of my long story of how I got here. But it's funny because I never in a million years was like, this is exactly what I want to do. I didn't even know it was a thing, right? I was always like geared towards like, oh, I'll help people get back to playing soccer or basketball. And it's like, well, now I can help people like run and jump and lift and do whatever they want after having 6 kids, for example, and have no problems at all. So it's kind of fun.
Yeah, and it's funny you say that because I think I've had at least a dozen PTs on this podcast before, and literally nobody has said once, like, I knew I wanted to get into pelvic PT. Like, it's
Literally.
always similar to what you're saying. Like, I had no idea,
Yeah.
and then it just like you fell into it somehow.
Yeah. And everyone always has that like injury story. It's like, well, I was injured. Well, I had a baby. It's like, well, and that's the story for a lot of people. Like they become pre and postnatal specialists or, trainers or PTs or whatever. It's like, I was an orthopedic PT, then I became a pelvic floor PT because I had a baby. And it's like, it's kind of crazy. Like it just is a light switch for some people, and then other people, it's like, oh, I knew this all along. But pelvic floor is never really talked about. Like when you're in high school, you're like, what's that? Ew, I don't want to do that. Like,
Yeah, totally. And it looks like you are someone who really enjoys exercising, and I'm sure what you've learned has helped you, stay healthy, right?
totally. Yeah. Yeah. There's a lot of things like that I came across in pelvic floor, like certifications and like trainings that I did that I was like, oh my gosh, like, how did I not know this before? Like, how did I miss this before? Like, my male trainers that I had growing up, or even like my female coaches, like my volleyball coach, like any trainers that I took classes with, like in college, like nobody knows about this stuff and nobody talks about it, and it's just like wild. The whole concept of it all, and yeah, I just like how I got here is just kind of crazy.
You're so right about that. Like, I was a three-sport athlete growing up, and I played volleyball in college, and like, we never talked about, I mean, you talk about form when you're lifting and, all of that stuff, but at the same time, like, I was not, my form was crap. And my pelvis would tilt weird. I wasn't breathing. Like, there are certain things that I think if my coaches were educated and could educate me, I feel like I could have avoided a lot of the issues that I have as an adult.
Oh, totally. Absolutely. And it all comes back down to just like knowing your body. Like, how does your body properly work? I think there's a lot of like just disconnect between like exercise and training. Like, I got out of college. I mean, I got out of high school really. And like, I was very active, played all the sports like year round. Like, and then when you graduate and you don't go to college for a sport, like you then have to find physical activity in some shape or form, right? And when you go from sports to figuring it out on your own, it's like, okay, do I just start lifting? Do I take
Yeah.
fitness classes? Do I start running? Like, what the hell do I do? And so that was me. It's like I did the P90X, I did the insanity workouts. Like I did, I joined, I went to I went to the University of Iowa for college. And so I went to the rec and I took their classes and I lifted and I had to figure it out on my own or take classes and learn from these other trainers. Right. And so I never really was taught how to really properly engage my core, really properly breathe. They're always just like, make sure you breathe, make sure you engage your core. And I'm like, I think I am. Like, I don't know. I never really took a class or like you don't really learn until, and social media was a thing, but like Instagram was not the side that Instagram is now, like in 2012, right? When I was in college. And it's just funny how like you like evolve, and social media is great, like in how you can learn things and how you can actually learn to engage your core and engage your glutes and breathe and all of these things. But it's like we were never taught. And when you're exercising, that's what exercise is. It's like you can just go and willy-nilly free for all move your body and burn calories and sweat and do whatever you want. But that's not to say you're actually training your muscles, right? And so back to what I was originally saying is like the difference between exercise and training is really that. Like there is a difference between properly engaging, making sure you're using like real like your muscles in terms of like body mechanics when you're actually squatting, or utilizing your glutes and your hip flexors and your quads and your hamstrings, and or are you just like flopping down and sitting down and standing back up, right? And I
Hmm.
think that a lot of issues come about when we just exercise and run and jump and lift and do all the things to burn calories and sweat and not actually like slow it down, time under tension, tempo training, like actually feel the muscles burning. Well, that's a whole nother story. Like, but not gonna go down that rabbit hole. But like, you get what I'm saying. It's like you have to be able to know the difference between the two, and you only really know that when you are kind of forced to. When it's like you hurt your back, or you have a kid and you have prolapse, and then you have leakage, and it's like someone's telling you, well, you need to breathe better, you need to engage your core better. And for someone who's exercised all their life, and they're like, what do you mean? Like, I do that already. So it's just silly, and it's like a lot of, you just have to slow it down and like focus on what matters most when you're training, and not just like going to burn calories and break a sweat and all of that.
Yeah, and I'd love to talk about that a little bit later in this conversation, but I think what I want to talk about first is the reason I brought you on this podcast, which
Yeah.
we kind of had a little bit of a conversation about this on that Instagram live that we had. But a lot of people in the interstitial cystitis and overactive bladder, I guess also pelvic floor dysfunction communities, people are telling me that their pelvic floor physical therapist is telling them to avoid strenuous exercise or stop doing squats or stop doing, the type of exercise that people are enjoying doing. And I wanted to get your thoughts on that recommendation.
So, as far as like, I mean, overall, like exercise is best, right? We need it. There's so many healing benefits for it. But the problem is with overactive bladder or IC, there comes a pelvic floor component that leads to more tension than not. Like if you're riding in these symptoms, you're riding on the pelvic floor tensor side. And so doing strenuous activities like heavy lifting can exacerbate the issue, because there's a few caveats to this. Not because heavy lifting is bad. Like, I'm not saying that. Like, let's just throw that out on the table first. Like, it's because oftentimes, if you're already having a lot of pelvic floor symptoms, you're probably not having good range of motion to that pelvic floor to start with, right? Like, you don't have range of motion to the pelvic floor. You probably have limited mobility and flexibility and even strength in your hips. And so jumping into heavy lifting, and I'm throwing that out there as like heavy, like strenuous activity, like more than 75% one rep max, maybe even less than that, right? Like, you're contributing to the issue if you're overactivating your glutes, you're overactivating your hamstrings, you're squeezing the crap out of your pelvic floor. That's where sometimes, PTs out there that are not super well versed in the strength and conditioning side of rehab for pelvic floor patients, they're going to be like, no, stop. Like, don't do any of that. Like, hard red flag, like, don't do it. But then you have some practitioners that are like, okay, it's both, right? It's and or. Like, it's not one or the other. Like, you can do both, but we need to have guidelines or tread lightly or modify your lifts or look at the way you're lifting, look at the way you're activating, right? Break it down. Like, there's that side too. And so I think it comes from a place of caution and like, we know it's bad, so let's just stop. And also fear. Like, I also, from like an uneducated point from a provider, being like, I don't know, so I'm just going to tell you to stop. And like, that's also a red flag too, because it's like, I always tell people, I'm like, your physical therapist or your doctor is as old as the last research article they've read. And if they're telling the same people the same advice for the last 10 years, research has evolved to show that exercise is safe with pregnancy, right? Like, you can't lift more than 20 pounds. Like, so there is a couple of things that you just want to be monitoring of when people are saying those absolutes, when they're like, you can't lift, like, you can't lift anything heavy, or you can't do squats, you can't do deadlifts. Like, it's like, well, hold on, pump the brakes. It's not that they can't. Like, let's just figure out why it would not be a good idea, and then what can we manipulate or modify so they still can, but they can do it correctly and not harm their symptoms or make their pelvic floor tension worse. And that's what I focus on. Like, me being like a female athlete doc, like, I only work with like a lot of active women, and I help them stay in the gym, still lifting, still doing the things that they love, because you can do both, and you can still see a difference in your pelvic floor symptoms, because loading the pelvic floor eccentrically, lengthening that, can actually really, really help overactive bladder and IC symptoms. But it's just doing it correctly and not living in fear of doing it at the same time.
Right. And I really want to talk about that fear component because there's a lot of different ways fear comes up in the IC and OAB communities. We see it with food, we see it with people being afraid to have sex or maybe told to stop having sex. And then in this case, like people being told to stop doing the exercise that they love. Like a lot of people, you're essentially taking away their identity if you're telling them that. And I think that's a really big issue for a lot of people because if you're starting to view something that you enjoy as unsafe, your nervous system is going to be, thrown further into fight or flight, and then it's just going to continue in that pain fear cycle and contribute more to your symptoms. So I really
Yeah.
do think the fear comes big into play here.
And it's also too like these are people's identities. Like if you're telling somebody that they can't do something that they've always done, one, they're probably going to fight back. Their nervous system's going to fight back. And like, two, they're like going to fight you on it. Like, how compliant are they actually going to be? Like, how happy are they going to be working with you and going through the treatment protocol with you? Like, granted, there's a level of trust, right? There's that white coat syndrome. Like, you know what I'm talking about, where it's like, my doctor said this, I can't do anything unless my doctor tells me yes or no. Like, not okay. We don't want to live in that world either. But it's like, you need to be able to siphon through the BS, right? Like, and find multiple opinions. And like, there's just so much that goes into it, especially when it is somebody's identity. Cause like, if you were my practitioner and you told me I can't lift, I'm going to find somebody else. Like, I'm going to find a way to still make it happen because that's my identity. I work out because I love it. That's who I am. That's who I've always been. Like, people are bullheaded. Like, they're gonna fight you, and it's gonna fight their nervous system too, because that's what they've always done, and that's what makes them happy, and that's what brings them good endorphins, and you know what I mean. People are gonna go crazy if they can't work out, and that's who they've always been. And I'm talking like the people that work out 5 to 7 days a week. Like, tell them they can't work out and watch what happens. Like, they're gonna find a
Right.
way.
Right. And then there's the other subgroup of this where it's like not the people who go like CrossFit type
Yeah.
exercise, but it's people who, they enjoy going for walks and maybe they do like a Pilates
Um,
class or something. Like, I think even being told to pull back on those types of things. Like, for example, I had a client, she's in college, and exercise really helped with her mental health. She has a
yeah.
history of mental health issues, and her PT told her to stop going to the classes that she was going to. And she was like, well, I'm kind of in a pickle here because this was helping my mental health. Now that I'm not doing these exercise classes that I was enjoying, like I'm really struggling mentally. And I just was like,
Mhm.
that doesn't feel like the right move in this scenario.
Exactly, exactly. And it's both ends of the spectrum, right? It's low impact, it's high impact. Maybe we meet in the middle, maybe somebody who is super super high impact activity, we're like, "Hey, let's find moderate to low intensity." And that might be a struggle, but that also takes the coaching component. And that's why having a physical therapist slash someone who can coach you through the process, and I know that you do this as well, like, it takes a lot to help somebody through the thick of it, and just giving people absolutes of yes or no, you and like black white, it's like you can't do this or you can do this. It's like, why can't we find something in the middle and coach them through it? Or even if it is an absolute, maybe if it is like, hey, you actually do have to pull back right now because your nervous system is in overdrive and you need to rest and digest. Like, maybe coach them through that process and be that guide for them, so that way they do know that in the end you do have their best interests and they can trust you, and that builds that alliance. And it's like, that's what's going to help in the end more than anything, versus just giving someone those absolutes like yes or no. It's like, well, that's not helping anybody.
Totally. I'm curious, like if you had someone come to you that was struggling with, let's say, bladder pain or frequency or urgency, and they want to be exercising, like what is your typical approach with people like this?
It depends on obvious. It depends,
I
right?
know, it depends.
it it like just comes out naturally. um it depends honestly on um their overall lifestyle. Like, that's how I'm going to, like, I'm looking at everything. I'm looking at the big picture. I'm looking at how they manage stress overall. I'm looking at if they're for example, I'm not like calling anybody out, this is just an example. Like, say they're a stay-at-home mom, they have 4 kids, their husband is gone all day, they have no family around, like they're strapped financially, like they're in this situation that is like really really high stress. Like, I might start them in a situation where I just have to focus on down training. Like, I might be like, hey, I know you love high intensity 4 times a week because it's your way of getting out. But listen, your nervous system's already up here. Like, we need to bring it down just like 5 notches. So if you can't manage stress well, we're not going to throw exercise stress on top of that. And if we're trying to get your bladder symptoms to calm down, which are entirely driven with the nervous system, we need to get your bladder to calm down too. But we have to pull some things. Like, I can't pull your 4 kids away from you. I can't pull your husband back into the house for you. I can't do some things, but there are some things within our control that we need to pull back on and improve other areas, like focus on down training, relaxation, breath work, meditation, maybe saunaing, maybe a low impact walks. Like, so there's some way where I'm like, okay, maybe not 4 times a week, maybe we go once to twice a week. And then we add in low impact walks, things like that. So right away, for that example, I'm going to focus a lot on down training, getting their nervous system to feel safe to start to heal, and then focus a lot on like urge suppression techniques and bladder retraining and giving them a bladder kind of scheduling or voiding techniques, as well as finding ways to also relax that pelvic floor through stretching, mobility, breath work, things like that. That process doesn't take a long time, right? That might like take somebody, and again, it depends on how severe the symptoms are. But if they're really, really symptomatic and they're peeing every 20 minutes and they're stressed out of their mind and they have a lot of things going on, it might be like a 4 to 6 week process. For someone that's really compliant and doesn't have a lot of stress going on, maybe it's a 2 week process, right? And then for somebody who's like, an opposite example would be like somebody who doesn't have a lot of stress going on, but they have just bad habits. They have overactive bladder from really bad habits, and that's contributing to a lot of their symptoms. Maybe it's not true IC, like it's more just driven from like habitual things. Then I might start them with a down training for like 1 to 2 weeks, but also load them in the gym right away. They might be somebody I like put them on a pelvic floor lengthening program and glute lengthening program where I'm like, okay, let's load the body. Let's still strengthen the core, because they're in a position where they can, their body can handle the extra stress of exercise because their cup is not overflowing by 500 other things. So obviously those are like 2 opposite end spectrums, but that's kind of the way that I treat. That is a lot different than most physical therapists would treat, because again, I do more coaching where it's like I'm working with these people through the process versus just being like absolutes, like yes, no, you can do this, you can't do this, because I can't change their lifestyle if I'm not directly working with them and I see them for only 15 minutes once a week. So it's really hard, like, but all in all, the really big answer just comes down to it depends.
Yeah. And I mean, I already knew that answer. Like everybody's so different. But you did mention some bad habits or some habitual things. I wanted to see if you could be specific about those just in case somebody out there hasn't heard of these things before.
Yeah. So like habitual things that a lot of nervous system dysregulation as far as like bladder control happens like growing up. Like what our mothers do, our grandmothers, our caregivers, whoever, they teach us, right? We learn from them. Not going to the bathroom in public, holding your pee all day long at school. Like, don't go to the bathroom at school. Wait till you get home.
Pee
Using
before
water,
you leave the house.
pee before you leave the house, like, no matter what. And like, and there's gonna be people listening to this that are like, okay, well, you try going to the grocery store with 4 kids and like getting them into the bathroom. You're gonna have those people out there that are gonna throw those excuses out. But it's like, not even an excuse, but like, of course you're gonna need to deal with those situations when they arise. But like, let's not train your kids to go to the bathroom every time they leave the house, like just for your convenience of not going to the restroom in a public spot. Like, yeah, public restrooms can be dirty, but I guarantee you they've done research that states that public restrooms are cleaner than your own restroom at home because they clean them every day, and I don't clean my toilet every day. Like, you don't clean your toilet every day, and I'm calling you all out on this podcast right now.
It's funny you say that.
Habits, like, they just add up. Like, when you're doing this when you're like 4 years old or 6 years old, and then you do it into high school, and then you do it into college because your mom told you peeing in public is gross, right? Hovering over the toilet, that's another bad habit. Peeing with water on every single time.
Like pushing your pee out. Is that
Pushing
another
your
one?
pee out, yes, because you can only pee in 5 seconds. Like, you better push it out, like, so you can hurry up. That's another
Teachers,
thing. Like,
that's for you.
yes. Nurses too. Like, Oh my gosh. Teachers and nurses like are always the ones that are like, well, I have to pee like so bad because I have to hold it for so long and then I get like a 2-second break. Like rightfully so, I get it. But it is these situations that cause bad habits, like plain and
Yeah.
simple.
My best friend is a teacher and she has water issues and she does not drink like a drop of water while she's working. And I'm like, you are contributing to the problem. But I
Mhm.
understand, like, it's not easy to get bathroom breaks when you're a teacher or
Yeah.
you're a nurse. Like, there's a lot of just like systematic changes that need to happen, which sucks,
Yeah.
but it is what it
Yes.
is. A side
It's
note,
also too, like
I
I always bring up to these people that have these types of careers, I'm like, listen, you're working for somebody else. They don't care about your health as much as you should. So if it's riding on productivity because you can't go to take care of your body, you need to be able to listen to your needs more. Like that patient can wait 1 minute or that whatever. It's the situations. Like I'm throwing playing devil's advocate here because people are gonna be like, well, you don't understand, you don't work in this environment. It's like, well, also too, like it's at your expense or your health is your expense at that rate. Keep going and watch what happens. I'm just throwing it out there that you should be more aware of your body and your body's cues and finding ways to make it work if you need to. Because
right.
in the end, you're going to be spending a lot of money to repair your health when you're 55 years old, that you're going to be kicking yourself being like, damn, I just wish I would have done something different. I wish I would have known better. Well, here we are. We are telling you, but I'm matter of fact. I'll tell you how it is. Like I'm very direct in that aspect.
Yeah. And you were mentioning like listening to your body's cues. And if you're ignoring these cues, your body's just going to scream louder and
Yep.
things are just going to
Yep.
get worse. Mm-hmm.
Yep. 100%. That's
Yeah.
just matter of fact, like telling it how it is. Like I can beat around the bush and be like, well, like, and that who's that going to help? Like, people are already doing that to you. Like, I'm just going to be like, this is what you need to do to change.
Yeah. I was at an airport this past weekend and I'm someone who I always sit on the toilet. I usually like
Yeah.
wipe the seat and this time I just visually inspected it and I sat down and it was wet and I was like, I have regrets. But
Oh,
I will never hover because one, it reminds me too much of like just playing volleyball and squatting, and I hate that. And I don't understand how women are doing it. Like I don't understand. It is so
you can't
difficult. And
relax your muscles.
I have muscular legs. I'm like, how are we doing this, ladies?
I know. Especially when you're like, well, honestly, when you're like somebody that can hold your bladder for a long time, like for me, I could go like 3 to 8 hours, like 4 to 6 hours. Like it doesn't matter. Like I can drink a lot of water and still hold my bladder really well. So sometimes I'm peeing for like 2 minutes because I'm holding it for like 6 hours or 5 hours,
Mhm.
right? So I'm like, I'm not holding a wall sit squat for 2 minutes on that toilet. Like there's
Right.
no way.
No. And it's just there's so many people out there that are squatting and that's contributing to the problem because you're peeing on the seat a lot of the time and like
Literally,
not freaking
stop
wiping
doing
it.
it. Yeah, that's why toilets are so gross, is because they're doing it.
Yes. Oh my goodness. Sorry, that was a side tangent that I just needed to tell everybody because I couldn't hold on
Everyone
to that
has to
story.
know. Yeah, no, everybody has to know.
Okay, so back to what we were talking about. I'm looking down like my list of what I wanted to ask you. And I guess I love that you gave the two examples of different people because everyone's different. But I guess like for the average person listening to this, like let's say they've been told to pull back on exercise and they're seeing a pelvic floor physical therapist, like I don't know, are there things they should be bringing up with their PT? Like are there certain things their PT should be doing with them? Like do you have any, advice with that?
Yeah. Um, I mean, across the board, I think that like goals are a big thing that should be discussed. I know that a lot I mean, I'm going to go and put my coaching hat back on right now. Like I think that you have to discuss your goals with your provider. And I know that a lot of people's goals initially are surrounded around symptoms. I just want to not pee myself anymore. Like, I just want to not have pain when I pee. Like, those goals are very valid and should always be the first and foremost goals. But that's a short term goal. And so we also need to focus on long term goals. Like, what does it mean to you to not pee your pants? If you don't pee your pants, what does that look like for you to be able to do X, Y, and Z? Does that mean that you can now go on a run? Does that mean you can now go for a walk? Blah, blah, blah. You need to be able to talk about your goals because that's ultimately what your rehab should reflect. If your rehab does not surround your life, your goals, whatever you want, run. Period. Like, I stand by that, that there is no ifs, ands, or buts on that. Like, you do not have time to waste working with somebody that does not care about what you want to do in the long term. And that's really tough to hear because that's sometimes providers are just so busy in the day to day, the mundane, they have patient after patient after patient that they're not thinking about asking you about your goals. So it's not even the provider's fault every time. Like, I'm not faulting PTs. I worked in a clinic where it was a mill and I was seeing 3 to 4 patients an hour, pelvic floor patients. Yeah, not even one-on-one. Like, I was in that position and I had no brain capacity to ask my patients about their goals because I was just one patient to the next on hearing about people's symptoms all day long. Boom, boom, boom. It's like I didn't have the capacity to ask. So here's my other plug is that you have to be an advocate for yourself. You have to discuss with your provider, hey, I understand that you don't want me to lift, in this situation because of my symptoms, but I also really, really love lifting. Like, this is a part of who I am, what I love to do. Like, can you give me a timeline of maybe when we can start lifting again? Or can you give me a timeline of what this looks like? So, like, you're asking questions that surround your goals. Because if you don't ask, they're not thinking about it probably, which means you're just going to keep showing up over and over again with the same exercises. Hopefully you get progressed. Like, you're in this cycle of like, I don't know, but my PT said I can't lift. Like, I literally onboarded a client probably 2 months ago for overactive bladder, IC. She's had IC her whole life. And she was seeing a pelvic floor PT, paying out of pocket for manual therapy and dry needling for 4 months. No exercise progressions. None. And I'm like, okay, who can I be mad at in this situation? Right? Because it's like, PT, that's your role. You should absolutely be asking about goals. You should absolutely be trying to find a way to modify their lifestyle to fit your treatment plan, yada yada. But also at the same time, it's the patient's role and responsibility too. Hey, when can I do this again? Hey, what's it going to look like? Hey, can we reevaluate in 2 weeks? Can I try? Can I go for a walk? Can I do XYZ? So it's both sides. And I just went on a tangent on that, but I'm very, very passionate about
No,
that because I worked in that environment and I was like, okay, I see both sides here. Like,
I'm so glad that you are bringing this up, like advocating for yourself, because I think a lot of people with bladder symptoms, and this is something that I've been noticing and I've heard other practitioners talk about, is a lot of us are, people pleasers and we're worried about what other people are thinking of us. And sometimes that prevents us from asking questions. And you kind of just go along with what the practitioner is saying and what they're recommending. And, you know, if they ask, some of them don't even ask, like, do you have questions? They're just like in and out. And that's so
yeah,
frustrating. You feel like you're not being heard. And it's like, this is your job, essentially, whether you want it to be or not, it's your job to ask the questions, to push for answers. And I think it's helpful to reflect before your appointment or whoever you're seeing on, like, okay, what do you want to accomplish out of this visit? Maybe brainstorm some questions you want to ask in case you are like me and you get flustered when you're in person with the actual
yeah,
practitioner, because it's so
yeah,
fast paced, especially when you're seeing someone like and using insurance and not, having all the time in the world with someone like you. It can be overwhelming, and I think it's great that you brought that up. Like, it is your job, whether you
yeah.
like it or not.
Yes, because no one else is going to save you at the end of the day. Like, really, like, that's as cold and harsh it is. But it's like I've been through the medical system myself. Like I have my own struggles. Like I was a pelvic floor patient. Like I did have all these injuries. I have other like when I got a hormonal birth control, like I had all of these systemic issues, and like my doctor was like, "Well, let's just put you on birth control again." And I was like, "No, that's not what the solution needs to be." And I've had my own fair share of struggles, so I come from the side of like no one's coming to save me but myself. So I have to advocate for myself. I have to find the people that are going to listen to me, going to actually spend the time with me and provide a solution that's with my lifestyle, not against it. And I think that that's so, so, so important when you're on your own journey, especially if it's chronic. Like if it's acute and it's like it just started, like weigh out your options, right? Like go, get all the treatments that you need. But if you've been dealing with this for 3, 5, 10 years, like it's time. It is absolutely time to be your own advocate. Like that, when it's longer than a year, I'm like, all right, this is in my own hands now. Like I'm figuring it out.
Yeah, because you're really just wasting your own time and money and energy. I was that person. I used to do every single thing my doctors recommended to me, whether I agreed with it or not. And that just prolonged the amount of time it took me to get relief. It took me like over a decade between when I was diagnosed to actually getting relief. And that's because I was just doing all of these treatments that they were recommending, like the medications, supplements, diets, installations, all of those things, and nothing helped me. And I wasn't asking questions. I mean, I
Mhm.
don't blame myself because I was in college and like I didn't know better, but
Right.
and there wasn't a podcast like this out there. Quick plug.
I know.
Um, but I wasn't being my own advocate, and it took me a really long time to get
Yeah.
there. And I just think that having these conversations is important for people to hear because this is going to save you time, money, energy, sanity. Like, this is really important for you to hear.
Yes. And it's hard. It's a hard truth to hear, but it's like, trust me, like, I don't want that for you. Like, I don't want you to be the one that like is the problem solver of all your solutions. Like, yes, I wish doctors would show up, but it's like we can't change that. Like, it's just it is what it is, and it's just like it's a hard truth. But once you accept it and then you start being your own advocate, you're like, oh my god, I'm so powerful. I know so much more about my body. Like, it's so empowering that in the end, you're like, I'm so glad I did that. Like, I'm from where I was and where I am now, and I'm sure you are too. Like, you're a walking light for women to go be advocates for themselves because you're like, I did the thing. I walked the walk that you walk. And so you get it. I get it. Like there's so many people out there that just need to go through it to then get it. And then on the other side, they're like, I'm so glad I did that. Right.
Yeah, exactly. I love that we just had this conversation. This is going to be really helpful for people. But I do have a couple more questions regarding exercise before we get to the
Perfect.
end of this. So I I work with, people with IC and OAB, and I will say it's kind of I can't really describe like the split of where symptoms are occurring. So let me just kind of clarify. A portion of my clients who struggle with exercise, they're having symptoms while they're exercising. And then I have another portion of people who are having symptoms after they're done exercising. And I have
Mm-hmm.
learned through my research that after exercise having a flare up or symptoms, that's usually related to your nervous system. Um,
Mm-hmm.
Feel free to correct me if you have other information, but for the people with symptoms while they're exercising, like what do you recommend that those people do?
So you're talking about like mid workout, like they're having
Yes.
pain, pelvic pain, or like
Yeah.
bladder pain, for example.
Yeah, and I
Um,
know exercise is different. It's like running, lifting, classes, anything. Like I don't know if we can be specific really.
well, I do know that a lot of heat can exacerbate bladder symptoms. Heat is a weird trigger. Like I've been learning more and more about this lately, and I've had patients that are like anything that's like hot that causes like a hot yoga class or like running outside on like a humid hot day. Like I'm like, this is so interesting. Um, so I'm thinking body temperature raises the nervous system response, increases a lot more cortisol, which then increases the fight or flight sympathetic response, like you're mentioning. But I also think too that there's art, like if I'm like basically focusing on just like the pelvic floor and like what's the pelvic floor doing in this situation. um if they're already in a fight or flight state, there's probably a good chance they're already riding or having a lot of pelvic floor tension, so maybe they're having a flare up of pelvic like symptoms, right? Causing pelvic pain, bladder irritation, like restriction of the muscles, poor blood flow to the actual pelvic floor. Like, so I think there's like a combination of both muscular activation as well as nervous system, like heightened response. Um, at that time, that's usually when I'm like, okay, probably not the best form of exercise for you in that. So if it's running, if it's CrossFit, if it's hot yoga sculpt, like whatever it is, like then that's probably a trigger for you, which means we can't be doing that activity. We need to find a lower impact activity that's similar to that to then work you back up to that activity.
Yeah.
That's probably my probably best explanation without actually knowing like a real true situation.
Right. And I can give kind of a personal experience here because I was just thinking like what were my triggers when I was exercising, and brings me back to like college volleyball. It's kind of, I think, three different things. So first would be just that general holding tension in my pelvic floor. I was chronically stressed, chronically anxious. Volleyball is a high pressure sport. If you mess up, everybody knows it. Like,
Yeah.
there's a lot that comes down to like the mental component of it. So that was the first thing for me. The second thing was, what was I wearing? Was I exercising in tight leggings? Was I wearing
Mm-hmm.
my spandex that we had to wear?
Mm-hmm.
Like if it's too tight, I know that that would contribute to, because my skin, my muscles, everything was just so on alert and really
Yeah.
sensitive. So that really contributed for me. And then the third thing was if I wasn't drinking enough water, that dehydration really came into
Mm-hmm.
play for me, especially towards the end of the workout. So that is what I recognized when I was going through it as my triggers with exercise. I don't know if you
Oh,
have anything
absolutely.
to add.
Yeah, tight clothing. So anything compression, like when I'm working with somebody who has pelvic floor tension, and I've even talked about this on my social pages, is that literally like stop wearing those compressive clothings. Like I get it, like it feels good to be like held in, sucked in, but it's like if you're having pelvic floor symptoms and tension, like there's a good chance you're probably sucking in all day already. Like let like one time of the day, like just let it relax. And if you're sucking in already chronically and you're clenching your glutes and you're clenching your pelvic floor all day long, and then you add compression on top of it, like it just doubles it. Because when you're wearing compressive clothing, like you're not relaxing in that compressive clothing. Like nobody is like, it doesn't feel good to like when you're wearing tight jeans after you just ate a big meal, like it doesn't feel comfortable to relax in that, so you have to unbutton it or roll it down or whatever. Like same thing when you're wearing compressive clothing and you already have like a tenser body, right? Like your chronic ab gripping, chronic pelvic floor gripping, like you're literally contributing to the issue with compressive clothing too. And some women that I work with who are very active are, believe it or not, I work with a lot of like trainers, and like my clients are literally trainers, or coaches or whatever. And I'm like, you got to stop wearing compressive clothing all day long. You're doing it during your workout and then you wear it all day and you teach all day. Like we've got to get you in looser clothing, like Butterluck's like spandex, or not spandex,
They
but like
make
those like,
really cute joggers nowadays.
yeah, joggers too. It's like you're wearing clothes that literally cause you to suck in all day, which just further exacerbates the issue. So working out in it, and you're chronically clenched, and you're doing a high intensity activity, like it's like a trifecta, right? Like you're just adding fuel to the fire.
I will say I found the perfect pair of like roomy joggers. It's from the brand Viore,
Yeah,
and I think they're called the Luxe at Ease pants. They're like the harem pants from back in the day. Like there's so much room in the pelvic floor area. They're a little on the
yeah,
pricey side, but like trust me, they are so comfy.
yeah. And it just gives you like room to breathe. Like we just live in a culture that has like taught us to kind of like suck in our stomachs, and I actually just made a post about this like 3 days ago, and it's like, tell me you have a tight pelvic floor without telling me you have a tight pelvic floor. And there's like some comments on it that are like, I've been sucking in my stomach since I was 10, and I'm like,
Oh
okay,
yeah.
like that's where it comes from. Like it's crazy.
Yeah. So earlier you were talking about how you recommend like down training after a workout. Can you give examples of what this looks like?
Yeah. So something as simple as like if I'm doing like a heavier leg day and I struggle with pelvic floor tension, like I sit, I am a chronic clencher. Like I do the same things that people do. I just don't have symptoms now because I manage the symptoms by not letting it become a problem. And so for me, it's like, well, if I know that I have like posterior pelvic floor tension, so like my tailbone gets really tight. That's usually like where all my symptoms are. And so after like a leg day or like a glute day, like I'll spend time doing like 2 minutes, 2 to like 4 minutes of pelvic floor relaxation. So doing like a happy baby stretch or like yoga, like a yoga squat, like a deep squat, if you're unfamiliar, child's pose, doing something that like kind of just opens the pelvis and then focusing on like diaphragmatic breathing. So I'm promoting lengthening as well as relaxation into that pelvic floor and like glutes and like my pelvis overall, as well as down training the nervous system by doing something like diaphragmatic breathing to recruit more of that parasympathetic relaxation state. So I'm doing a twofold in that position. Like I'm breathing one helps you to tap into range of motion of the pelvic floor, but also it helps to tap into the nervous system. So that's a two for one deal there. And then I throw in the stretch as well to open the pelvis because in those positions that's when we can get really a lot of lengthening to the pelvic floor, just literally from a muscular standpoint. So doing that, you can do it after every workout if you want, especially after a high intensity workout. I would 100% recommend that. Get your nervous system back down, and then for sure after like like a lower body lifting day, like that would be another thing to add in. And this is preventative. Like this isn't something you have to do. Like I'm not telling you guys to do this. Like this is literally like if you're a chronic glute clencher, ab gripper, like you have pelvic floor symptoms, like there's no harm, no foul by spending 2 minutes doing this at the end of your workout every day or at the end of your day every day, by just like focusing on that relaxation. And it's a freaking game changer. I have a 6 minute YouTube video on this and my whole routine. It's on my
All right,
YouTube.
we'll link it for
Yeah,
sure.
it's really good.
Yeah, my bar studio after each class, we do like 3 to 4 minutes of guided breathing, and it's so awesome. I love that they do it. And there's
So
always
good.
people that are like leaving before that, and I'm like, where are you guys going? Like, this is the best part.
Russian for the next thing. Yeah, I know.
Yeah. Oh
I
my
used to
goodness.
do a hot yoga studio. I used to be a member there, and every time we ended in like shavasana, and it's just like, oh my god, like it was like 2 to 5 minutes, and you're just like breathing and like laying there, and it's like so meditative, like so peaceful, and everyone just like rushes out. I'm like, I'll be here all day. Like no one needs me right now. I'll be right here. It's so relaxing.
Hmm. Yeah. Um, what the last thing I wanted to ask you before we wrap this up is you earlier were talking about like training versus exercising. Can you talk more about that? Like, proper use of your core and like tuning into all of that?
Yeah. So like I said at the beginning, like I used to be that someone that just like flopped around working out, like high intensity workout classes, I'd run and then I'd do like squats. And it's like when you're going for time, like it's like, okay, you only have 6 minutes, get through as many rounds as possible, or 3 rounds or whatever. It's like I didn't care how I looked or how I felt or whatever. I was just doing ten reps of squats and I was just squatting up and down, up and down, up and down. And it's like I wasn't worried about my core being engaged or what my breath was doing, like, or using my glutes to stand up. Like, I was just doing sit to stands. Like, that's literally exercise, right? And that's fine. Like, there's nothing wrong with this. Like, let me say this. Like, if that's your goal, if you don't care, like, cool. No harm, no foul. Do that. Like, but if there is a difference in training. Like, it's like, okay, when I'm sitting down, I'm intentionally thinking about extending up with my hips. My core is engaged the whole time. I'm exhaling. I'm allowing my breath to come out of my body as soon as I'm standing up. And I'm letting that pelvic floor recoil back up. Or, for example, a push up, right? Like that's why they tell you there's proper form to things. Like when you're doing a push up, for example, or a pull up, it's like use these muscles, use these cues to engage the right muscles to get you up to the bar. So you don't end up having neck pain or like shoulder pain or all of these things. And it's like the difference in training is that you're just more mind to muscle connection. You're more intentional. You're more focusing on slowing it down, like time under tension, like going slower as far as like in the eccentric phase, in the concentric phase. Like you're not just like up, down, going for speed and trying to get through the workout. And there's probably going to be some backlash to this. Like if another PT hears this conversation, they're going to be like, "Oh, she's wrong." But there isn't any wrongness to that because like you see the cardio bunnies and the people like jumping on and off the treadmill doing like things in between, and then you see the people that are like bodybuilders in the gym and they're like massively huge. It's like they didn't get there by mistake. Like they trained their muscles to get there. And then there's the other people that are they don't look like that, and it's like they're in the gym, I don't know, the same amount of time, same number of days of the week, and they look exactly the opposite. And it's like, well, how did that happen? Like if there's no difference between the two, right? So that's kind of like you can kind of just use like visual examples for that, like people that are really focusing on their muscle building and time under tension and not having pain and all these other like functional movement training. And then there's people that are just like going for the sweat, going for the cardio, going for the calorie burn. And don't get me wrong, like there's nothing wrong with both. It's just where are you at in your lifestyle and like what do you want to focus on? Period.
Mm-hmm. Okay, cool. I love that. Anything else you feel is important to discuss here? Or do you feel like we covered a lot?
Yeah, I feel like we've covered a lot. I think your only other thing was like advice for people, right? Like,
Yeah, feel free to give any sort of words of wisdom.
my biggest thing, like going through pelvic floor dysfunction, is a lot of like the fear and mindset around it. A lot of, I just like to position pelvic floor issues and just like an injury to the body, just like anywhere else. And it's like when people think about leakage or prolapse, like their organs are falling out, or bladder issues, or bowel issues, incontinence, like anything, it's like I think there's a fear around like I'm not good enough, I'm broken, and there's a lot of narratives around just like being because it's a vulnerable spot of your body. But it's like that's a pelvic floor injury, just like a shoulder injury, just like a knee injury, just like a toe injury. Like we can't just like put it into a box of like tied to our worth now. And a lot of women do tie it to their worth. Like I'll never be the same. Like I'm always going to be broken. I'm really insecure about it. And it's like, well, no one's insecure about a shoulder injury. No one's insecure about a knee injury. Like they like just go to PT and they do their thing and they get on back on the horse. And if you're struggling out there with like a pelvic floor issue and it's maybe been a really long time, like think of your body as like just it's another part of your body that's just like anywhere else in the body, and you deserve healing. It is not tied to your worth. You do not have to have fear around your entire lifestyle. You don't have to change your entire lifestyle to focus on that one single area. Like there's absolutely help out there. It's not just normal. Like you don't just pee after having a baby because just because you had a baby. Like that's like saying, oh well, my knee hurts just because I had a baby. It's like what? Like that doesn't even make sense. Like you know what I mean? It's like you can't identify with certain narratives. Like you absolutely deserve healing. You can heal. There's people out there who can help you, and no matter what you're going through, like you have to just keep believing in yourself. Be an advocate for yourself. Like no matter what, like all of this stuff is fixable, and somebody out there will help you, even if it's been 10 years struggling with this. Like you said, like it took you a decade, like, but you got there. You figured it out and you did it. And hopefully those are some words of encouragement for other people out there too.
Yeah, those are great. Um, and if somebody's watching this and they're absolutely in love with you and your methods and beliefs, are you currently taking on new coaching clients?
Yes, my company is. I have a physical therapist that also works with me, and her name is Dr. Ali, and she's amazing, and she's taking on new clients right now. I'm kind of on a hold as of this recording, but yes, we are. But we also
Okay.
have a free academy too. Like we have a free school account where it's like a community of like women that want, and there's a ton of courses and education in there. So even if coaching is not like 100% up your alley right now, then we have a lot of other free resources for women to at least just get started in their journey.
Okay, amazing. I will link all of that in the show notes. And I just wanted to say thank you so much for coming on. This has been a really fun conversation. And yeah, I had a good time talking to you.
Thank you for having me.